A question when it comes to mobility, range of motion, strength, training athletes, especially somebody who needs a lot of range of motion like a gymnast that we have here. There's a lot of things we can do if she goes into a split and she can't get all the way into her split because she's tight. So if she can't get all the way down, go ahead and come back up, we could do a lot of things. And a lot of those things are passive or passive assisted with me making her body do something by me doing a stretch or a mob or a release. My question is, wouldn't it be better if I did something that allowed her body to function the way it can function at its best, neurologically, proprioceptively? So if I trained her body to get into a full split, go ahead. If I did that by training her to have motion, strength, and stability to get there neurologically versus me forcing her to get in that, could she maintain this longer and not have to repeatedly come back to me or do some kind of a gimmick to get into that range of motion? Let me know what your thoughts are. Would you rather train somebody to maximize their neurological function and proprioception, or force them to do what you think they should be able to do because you're the medical professional?